According to the Family Medical Guide written by the American Medical Association in the 4th edition book, scoliosis, or an abnormal curvature of the spine, develops during the period of rapid growth during puberty. This typically happens between the ages of 10 and 12, and girls are more affected with scoliosis than boys. With most typical cases of scoliosis, the cause is undetermined. However, there are types that are genetically passed down, present at birth, or due to neurological or muscular disorders. Sometimes the curvature of the spine is unnoticeable. The curvature can cause the hips, shoulders, and waist to be asymmetrical. The affected person's legs can appear to be uneven due to the head of the spine, and their shoulder blades may stick out. Scoliosis can be severe or life-limiting, as it at times affects a person's lungs and heart depending upon placement of the misshapen spine. I learned in the Mayo Clinic Family Health 3rd edition book that scoliosis is diagnosed either by a simple visual X-ray exam or an X-ray that is taken to measure the amount of the dress of the curvature. If the curves are small, no treatment is needed. In growing adolescents, a more severe curve may be treated by wearing a brace. The brace is worn to assist to straighten the spine and ultimately correct the deformity. At times, surgery may be indicated for severe curvatures, and exercising generally does not help with scoliosis. According to the National Scoliosis Foundation website, scoliosis affects 2 to 3% of the population, or an estimated of 7 million people in the United States, and there is no cure. And I am part of that 2 to 3%. When I was 12 years old, I was just like any other 12-year-old. I loved being busy with activities, hanging out with my friends and family, and I loved to ride my horses. I participated in volleyball, which then led me to have to get a physical done at my hometown clinic. It was just like every other physical until the end. My doctor then discovered that I had scoliosis, and she quickly called my mom at work to let her know. When we went to another doctor appointment to get some more opinions on it, he didn't recommend anything and said it should get better since I'm not done growing yet. Fast forward 8 years later to it bothering me every day and finding some daily tasks hard to do. My parents and I decided to go to another doctor in Sioux Falls. After tons of x-rays and physical therapy, I am finally having surgery in May. I will be in the hospital for 4 days and 4 nights. There will be 2 weeks where I can do absolutely nothing, and 5 months I will have a weight restriction of 15 to 20 pounds. I cannot jump, run, or do anything that jars my back. During my surgery, I will be under for about 3 to 4 hours. The surgeon will make an incision about 7 inches long on my lower back and insert metal rods to correct the vertebrae that are making my spine crooked. The way the doctor explained it to me was that it was just like putting braces on teeth. People aren't very educated about scoliosis. I sure wasn't until all of my doctor's appointments. Scoliosis doesn't just affect your back. I have a hard time with many daily tasks. It is very hard for me to reach up and put my hair up. I work at a daycare, and it is getting very hard to pick up little children to change them. When I wear clothes, it is like I don't even have scoliosis, but as soon as I take my shirt off, it is very obvious. I just went to my pre-op appointment for my surgery, and they took more x-rays of my back, and this is what it looks like. I am considered RISR 5. Defining according to the National Institutes of Health website, the RISR scale is used by orthopedic physicians and surgeons and indicates the level of bone growth and maturity of someone's bones.